Welcome to the Her Fertility Podcast. If you've been told to just trust the medical system, or on the flip side, to only focus on holistic healing and neither feels like the full picture, this space is for you. I'm your host, Jess Tims. After navigating my own infertility journey, I left my corporate career to create Her Fertility Support because women deserve more than rushed appointments and one-dimensional answers. Here, we bridge the gap between clinical care and holistic healing, combining science and research with nervous system, mindset, and deep human connection because you don't have to choose one path. You get to use all of it. And when you do, everything changes. Let's begin. This is the third time I am recording this podcast episode. I don't know what keeps happening, but something is interfering with the information on advanced fertility testing. In this episode, I am going to share the advanced fertility testing that your practitioner is likely to prescribe for you if you have been diagnosed with infertility. And these are all tests that will be done before you do advanced procedures like IUI or IVF. So let's get into it. We're going to start with the easy one, which is male fertility. If you are the male partner, you can expect to have a semen analysis. And the wonderful thing about the semen analysis is it is a painless procedure that's going to give you a lot of data. Now, you can ask for a semen analysis from your primary care physician. They might refer you to a specialist, or you can opt to do an at-home semen analysis through a company like Legacy. And I will include a link for a discount to Legacy below. I don't get anything from them. They are just nice enough to give the listeners of this podcast a discount so that you can get your semen analysis done in the comfort of your own home, which is awesome and way less awkward than going into a clinic. And the basic semen analysis will give you 3 markers for your sperm health. It will give you sperm count, or how many sperm are in the sample. It will give you motility, or how the sperm are moving. If there's no movement, they're not going to get very far. And then the analysis will also see the sperm morphology, or the shape of the sperm. And it is fascinating, the different shapes and formations that sperm can take on. They don't always look like the little fish we see. Sometimes they have no tail or 2 tails. Sometimes they have 2 heads. Some have like a blunt head. And it's really important that sperm have a good shape because the egg is the strongest cell in the female body. And it takes a strong, healthy sperm to break through that egg to fertilize it. All 3 markers are really important to your sperm health. And in addition to those 3 markers, you can also opt for a DNA fragmentation analysis of sperm. And that is where they will look at the sperm's DNA makeup to see if there are any abnormalities in the DNA, which could be causing problems with an embryo. I'm all for having the most data possible about our bodies, so I say go for the DNA fragmentation if it's available to you. Now, for the female partner, the advanced fertility testing that's going to give you more data about your body comes in 3 parts. First, you're going to have an advanced hormone panel, which is a simple blood test that will test your reproductive hormones. Some practitioners like to do this test in 2 parts. At the first part of your cycle, typically within the first 3 days of your cycle, so once your period starts, you'll go in for a blood test. And that's because your hormones are at their lowest point while you're on your period. So they can test hormones and see their levels at that point. And then some practitioners will also have you come back during your luteal phase later in your cycle, typically around day 20, to test for your progesterone, because progesterone is highest in the luteal phase. And so they can get a good reading on your progesterone level at that point in time. Now, it is important to remember that all practitioners work differently and all insurance providers cover different things. So you want to get familiar with what is covered for you and what you have access to from your practitioner. And if you have questions, ask them, because you don't want to waste any more time just because you don't know something. So in addition to having an advanced hormone panel or blood test, you will also have your AMH level tested. Now, AMH stands for anti-Müllerian hormone, and it is the hormone that is secreted by the follicles that are inside your ovaries. So you are born with all of your beautiful eggs inside your ovaries, but they are not exactly mature eggs. They're actually follicles. And during ovulation, a few of those follicles will start to mature to become a fully beautiful egg to be released during ovulation. And typically only one egg is released, sometimes two. And that egg is released, it comes down the fallopian tubes for the chance to meet sperm and create an embryo. Now, your doctor can test your AMH level through a blood test, and what that will give them is an estimate of how many follicles you have in your ovaries. This is also known as your ovarian reserve. And the idea here is that the higher the level of AMH, the more follicles you have. And vice versa, the lower level of AMH, the less follicles you have in your ovaries. Now, it is important to know a couple things about AMH. This is a point in time reading, and AMH levels can change, not because the number of eggs you have changes, but because the overall well-being and health of your body changes. So the amount or level that's secreted by the follicles can change. And some practitioners will say this as like your egg quality or your egg health changes. Now, the frustrating part about this is we can't actually count the exact number of eggs you have. We don't have science to do that. Instead, practitioners will measure your AMH level, and they might do an ultrasound to see the health of the ovaries and to see that, yes, in fact, there are follicles in the ovaries, but we don't have the technology available to us yet to actually count the number of follicles you do have. So practitioners will make their best educated guess based on the data they can gather on your body to say you have a normal range of ovarian reserve or you have a suboptimal range of ovarian reserve. And ovarian reserve is tied to your age. This is a statistic that is measured based on your age because statistically speaking, younger women have more eggs and older women have less eggs. And so this is something that's tied to your age and will be measured according to your age. Now, in the next episode of the Her Fertility Podcast, we are going to do a deep dive on low ovarian reserve. So if you get your AMH tested and it's low and you are diagnosed with low ovarian reserve, we're going to deep dive into that so that you know more about the decisions you will be making at that point in your fertility journey. But regardless of what your fertility journey brings you, in addition to testing your hormones, your practitioner is also going to want to see that your fallopian tubes are open. And this is typically a mandatory test if you are going to do IUI or IVF. And practitioners will want to see that your fallopian tubes are open because if they're not, that could be what's blocking you from getting pregnant. And there's a variety of reasons why there might be a block or a subblock in the fallopian tubes. And so an HSG exam is the exam that will test for that. And essentially, they put a dye into the uterus, and then they use the force of gravity and tilt your body so that your head is lower than your feet, and the dye runs up through your uterus and then through the fallopian tubes, and they monitor that on a screen to see if the tubes are blocked or if they are open. Now, I shared my full experience with the HSG exam here on the Her Fertility Podcast, and I will say that everybody's experience with this exam is different. For me, it was pretty painful. It's not for everybody. And I didn't have any blocks, but I still experienced pain. But for me, it also was a pretty emotional experience because it was the first time in my fertility journey where I was doing an advanced fertility test. I went to my appointment alone. I didn't feel very prepared for the exam. I didn't know that it could be painful. I didn't expect that there would be like discharge of the dye afterwards, and I didn't bring like a pad or anything with me for that. And it was really the first time where I had to face the reality that I had infertility. And so emotionally, it was a really challenging day. It's a day I will never forget. And I definitely didn't set myself up with the support that I needed for that day. So again, everybody is different, but I would encourage you to set yourself up with support if you can, because you never know what's going to come out of left field for you when you're doing these advanced fertility tests. And here at Her Fertility Support, we have multiple ways of supporting your fertility journey. So whether you're someone like me who likes to do things on your own, we have a full library of resources for you. We also, of course, do one-on-one support, and we have our Fertility Support Circle, which is a group support that meets online once a month. And so seek out the support that you need during this time. You are not going to be in this moment forever. This is a moment. And so use the resources we have to support you during this time, because infertility was never meant to be navigated alone. And when you have the support, it just makes this journey that much less of a struggle. And so once you have the data from these advanced fertility tests, you will then be able to make the best decision for you moving forward. You will likely have a recommendation from your practitioner. You will likely have a recommendation from your medical provider. But as we talked about in the last episode of this fertility journey series, it's also important to listen to your inner guidance. So if you didn't listen to that one, go back and listen, because regardless of what your next steps are, it is unique to everybody. And so you can tune into what is the best next step for you. And if you are enjoying this fertility journey series here on the podcast, I would love to hear from you. I would also love to know what your journey has brought you and what information I can provide to support you through that. So find me on social media at Her Fertility Support, and I look forward to bringing you the low ovarian reserve episode next. Thank you for joining me on this week's episode of the Her Fertility Podcast. I am so grateful you're here. If you found this episode valuable, then I'd love for you to join me on the next one. Share it with a friend and rate the episode with a 5-star review so that the podcast can reach the women who need it most. If you have any questions about what you just heard, please connect with me on social media at herfertility.support. Find the right type of support for your fertility journey in the show notes below.